1,044. Over 1,000 of them are African American. And of the 138 deaths, 74 of 138 are African American. So again, we're seeing continued disparity of impact as we've been talking about. Also, and I think we're going to talk about this in a little more depth, but there's been some discussion about an emerging semi-hot spot in 53215, which is largely a Hispanic district. And that's something that I want to make sure we cover as well. But again, the soonest, the best way to be on the other side of this experience is to stick with social distancing, to be disciplined about it, to act as if you have the disease and you don't want to give it to anyone else, to stay home unless you have to. And to avoid getting within 6 feet of other people. The soonest way, the fastest path to restarting the economy is now clearer than ever. If we know that, hey, what are we looking for? We're looking for a metric, and that metric is the 14 days of declining new case numbers. It's what we're tracking conveniently, if you're interested, on our dashboard. But I want to get there as fast as everybody else, but the way we do that is we strictly adhere to the guidelines. And I am grateful to everybody in this community that I've seen again and again doing it, and the people who are supporting local businesses the way they can. I'll keep reminding folks there are more and more restaurants all the time doing curbside pickup. I've tried to hit as many new restaurants as I can locally, of course. But I know that when I'm doing that, and all of us are doing that, we're keeping jobs alive, we're keeping businesses alive, so that when we are on the other side of this, we can come out resilient. And I know that matters to everyone. So with that, I'll turn it over to the mayor.
And I'm sorry, let me interrupt for just 1 second. Pardon me, Mayor Barrett. One thing I forgot to mention is that we do have translation services with us today. So Patricia Ruiz Cantu is with us from the city of Milwaukee. Thank you very much, Patricia, for being here. And so before we proceed, I should just check, do we have any media on the call who would like translation services for each speaker as we go along? We can do it that way, or we could translate certain segments of certain speakers. It's a lot of work for one person to translate everybody who's talking for a half an hour. So if we could try to identify certain segments for translation, that might be a good way to handle it. So anybody, any media on the call who want to speak to that, or what your needs are? Okay, hearing none, I guess we're just going to proceed without translation in the moment of every speaker, and perhaps we can include translation for some of the responses to the questions, or if there's just a particular request from media for translation of, you know, certain facts or comments, we can handle it that way as well, if that makes sense. So thanks for your patience, and Mayor Barrett, please.
Thank you very much, Brian. And I want to follow up to kind of executive's comments. Now that we're in well over a month into this pandemic, we all recognize that it is hitting all parts of our country, all parts of our state, all parts of our community, but it's hitting different parts with different intensity. And that's part of the focus of today is what exactly is going on, why is that happening, and what can we do about it? I think that we all recognize, to the extent that there are healthcare disparities, whether there are life course disparities, if there are structural issues, that those are underlying issues that can make the situation worse. As we saw when this first hit southeastern Wisconsin, it was the African American community, particularly middle-aged African American men, that we saw were the ones that were dying fastest and first. That remains, as the county executive said, a very, very serious concern, and it underscores a lot of the long-term disparities that we have experienced here in Milwaukee and southeastern Wisconsin. The second group that jumped out to me, actually, and to others, I think to Commissioner Kwolek and others, was what we saw on the near south side with the Hispanic population. And although that is a hot spot, relatively speaking, to other parts of the county and the city, I believe the numbers are actually a little better than they would be if it were not for the presence of the 16th Street health clinics. because the 16th Street Health Clinics have been so proactive and so effective in reaching the population. I think our situation would be much more dire there if it weren't for them. So my hat is off in a huge way to them. Their ties to that community are so strong and so deep that they've been able to really, I think, focus. The third area, and one that we're seeing more and more of, are the long-term care institutions. And when I say long-term care institutions, I'm talking about healthcare institutions. And we've got approximately 18 of those in the city. There's more in the county. We know that nationally and in the state, we've seen outbreaks, some very serious outbreaks in long-term care facilities. We're seeing more and more the outbreaks in the congested penal institutions, and that's work that we're continuing to do as well. Here in Milwaukee, we had a real concern over the last week or so with the rescue mission. But again, I think this is where the plan that most people don't recognize went into effect several weeks ago has paid some dividends. We know that there's a lot of concentration of people in the homeless centers and places like the rescue mission. But the decision that we made several weeks ago to open Clare Hall, to have the Super 8, to have the other hotels there, has provided a relief valve and has allowed us to avoid the concentration that would otherwise be present in those institutions. And I think that's one of the factors that has resulted, now that we're doing the testing at the rescue mission, and we have seen some staff members who have tested positive, but one would think that would go immediately to widespread positive testing for the people who are staying there. And what Steve Mann was telling me this morning is that we have not experienced that. We're still concerned about the long-term care institutions, but again, I think the faster we can do the testing, and that remains my highest priority. I'm very, very pleased that the community health centers are now going to be opening their doors to their patients and ultimately to more. The city of Milwaukee's health department the last few days has been concentrating on the long-term care facilities, and we're about done with that. And so we're going to go to our next phase as well. So this is obviously, I think, an exclamation point in our society for those individuals who traditionally are in harm's way. And what I mean by that is the African-American population, the Hispanic population, people who are in long-term care facilities, the elderly, the frail. And although this pandemic is hitting everybody, I think that we have to be mindful that those portions of our population are paying a very, very high price right now. So with that, I'm going to turn over to Dr. Weston, who continues to do really, really solid work in providing us with the information that we can all use to make intelligent decisions. So Dr. Weston.
Thank you, Mr. Mayor, and good afternoon. Again, looking at our county dashboard, we have 2,359 confirmed cases in Milwaukee County and 138 individuals who have died of COVID-19. When this pandemic first started affecting our community, we saw that the hardest hit initial areas were predominantly our African-American communities. These communities saw a disproportionate number of cases and number of deaths. And over the last 2 weeks, we have seen an increasing number of cases in the southern end of the city of Milwaukee, in the more predominant Hispanic communities. When we look at trends in diseases such as diabetes and high blood pressure, we see similar trends in health inequity, higher rates of severe disease and death. Much like other historically marginalized communities, the Hispanic community nationally suffers a greater burden of certain illnesses than the white community, for example. Many of the same factors apply that lead to potentially higher rates of COVID-19. These are at times living situations that make social distancing more challenging, frequently jobs that are more difficult to telecommute, and challenges with taking sick time, decreased access to appropriate personal protective equipment in certain workplaces, as well as the added challenges of fear of deportation and lack of any sort of unemployment safety net for a segment of the population that is undocumented. There's no question that we're seeing an increase in the number of confirmed cases of COVID-19 in our Hispanic community over the last 2 weeks. And as you'll hear shortly, the 16th Street Community Health Center has done an outstanding job of not only testing this community, but opening their doors to people who were previously unconnected with the health system, with no true medical home. And as we'll see in the coming days and weeks, as our community ramps up our testing capacity, the more people you test, the more cases you'll find. And so the factors that lead to this predominantly Hispanic community rising up as a seeming hotspot in our county remain to be determined. It may be that increased testing that 16th Street has performed. It may be the inherent disparities that this community faces, or most likely it's a combination of factors. Either way, we're lucky to have 16th Street Community Health Centers in our community. And there's no doubt that without their presence, without their another of FQHC, Federally Qualified Health Center, community support, community engagement, and community health promotion, this is a region of our county that would have more cases and would have more deaths. So we'll continue to be transparent in our demographic, racial, and ethnic breakdown of cases and deaths. And we'll work to get more information on that not reported category of cases as well. And perhaps for this last part, if I could, I'd ask Ms. Ruiz-Cantu's assistance with interpretation just for a couple quick sentences, if you don't mind. She can unmute herself briefly. My Spanish isn't quite good enough to do my own interpretation.
She may have just had to step away to communicate with someone via text.
Well, that's all right. I'll just I'll say then. So I was just going to say it's of note on then the note of health system engagement. So we talked about health system engagement is related to. Oh, here we're back. So Ms. Ruiz-Cantu, if you don't mind interpreting these couple sentences. I think you have to unmute yourself there. There we go. So again, on the note of health system engagement that we discussed as related to 16th Street Community Health Centers.
En la nota que acabamos de discutir en referencia a los centros de salud de la clínica de la 16.
It's important to reiterate the previous messaging that emergency services, 911 system, ambulances, emergency departments are for emergencies only.
Es importante reintegrar que los servicios del 911 solamente son para servicios de emergencia.
Now that said, this safety net is available. It is safe. Go ahead.
Esto que acabo de decir es seguro.
It's available, it's safe, and it's able to care for you in your time of emergency.
Es seguro, está ahí disponible para ustedes en el momento de emergencia.
Despite the pandemic that we're working through as a community, you don't need to fear engaging in the health system when you need to.
Aunque estamos en medio de una pandemia, ustedes no tienen que temer de ir a pedir su ayuda. Estamos aquí para servirles.
This is not a time to neglect your ongoing health needs.
Este no es un momento para que ustedes dejen a un lado sus necesidades de salud en este momento.
All right. Thank you, everyone. Thank you to Ms. Ruiz-Cantu, and stay safe. Thanks.
Gracias y manténganse seguros.
Thank you so much, Dr. Weston. And next we'll hear from Ann Christensen, who's the Health Director and Health Officer of the North Shore Health Department. And similarly, Director Christensen, I think Dr. Weston demonstrated a good way of handling the translation requests. So feel free to follow in those footsteps if you choose.
Thank you. So again, appreciate the opportunity to be here on behalf of the 11 health departments in Milwaukee County. As you know, our public health system is as diverse as our communities. I represent 7 communities of the North Shore, from Shorewood up to Brown Deer, and am pleased to give you the perspective from the North Shore as well as across Milwaukee County. And by way of the data that we've been sharing with you in terms of Milwaukee County, we look at the daily trends and are hopeful that the mitigation measures that we've put in place, like Safer at Home, are making a difference. For those who don't spend as much time on that website as I do, the Milwaukee County Office of Emergency Management's, on April 4th, we reported our highest number of daily cases. That was 101. Whereas yesterday, the total of new cases being reported was 68. Again, it's something that we're hopeful about, that we're in the right path. We're not feeling out of the woods yet, that this is over and done with. But again, the daily trends that we're looking at give us some indication that what we've done and put in place are making a difference. I do want to talk about Governor Evers and his administration's Badger Bounce Back program. And specifically, one of the components of that is that every Wisconsin resident be able to receive a COVID-19 test should that person show signs and symptoms. So that's one of the pillars of this program to get us essentially back up and running. So, every day in local health departments, we hear frustrations of people who are showing signs and symptoms and are calling their providers and not able to be tested. So both locally as well as across the state, we're putting measures in place to expand that testing capacity. And I want to assure people that those measures are in place so that we can get to a point of meeting that very lofty but very important goal. Essentially, without testing, we're not able to know where cases are in our community. And for local health departments, by not knowing, we're essentially invisible to where those clusters and outbreaks are happening. And we're not able to put in our measures in those local localities to really isolate the problem and make sure it doesn't spread beyond those either geographic areas or facilities. So testing is a critical component in our work. It also provides us with information about who obviously is testing positive, but then what we're able to do is trace the contacts around those individuals who are positive so that we essentially develop that circle around them to follow up with people who've been exposed. And that, again, is super important so that we can stop the spread by putting those parameters in place around those individuals. So testing is very critical. So I wanted to mention that there are two things that are happening now and within the last day that help us to move that goal forward. One is that the Department of Health Services has put out new guidelines or revised their guidelines for healthcare providers to really encourage providers that if somebody is showing signs or symptoms consistent with COVID, their recommendation is for those individuals to be tested. So please, those guidelines are important to expand that pool of people that would be tested. And then secondly, I just wanted to mention again, more for the healthcare provider audience, that the Department of Health Services has set up the ability for systems to access testing materials and resources through the state. So if you are a provider and you don't have the supplies, contact the Wisconsin Department of Health Services for that information, and they can work to connect you or your system up with those supplies. Again, the goal being to get every Wisconsin resident tested who is showing signs or symptoms. That will help us to achieve these goals and get Wisconsin back on track quickly, which is what we all want. So those are my public health messages today, and I'm happy to take further questions.
Thank you, Director Christensen. Next, we'll hear from Dr. Julie Schuler, who's the president and CEO of the 16th Street Community Health Center.
Can you hear me okay?
Yes, we can. And let us know, or if you would let Ms. Ruiz-Cantu know if you need any translation.
Okay.
Go ahead.
Well, thank you to County Executive Abley and Mayor Barrett for calling attention to the Hispanic population in Milwaukee during the COVID pandemic. As folks may know, 16th Street is medical home to more than 43,000 patients on the south side of Milwaukee. We've been around for over 50 years, and we're a trusted ally in that community. Community health centers in general are in existence to be in and of the communities that we serve, being responsive to emerging needs as they develop. And I think this is a prime example of how we can flex to the needs of our particular communities as emerging needs do develop. We've stepped in early with ongoing testing since the onset of this pandemic and with prevention messaging and community outreach. And I thank Mayor Barrett and Dr. Weston for their comments, and I agree that I think that because of 16th Street, we've reduced the number of cases on the south side and really are working hard to combat the factors that people struggle with in some of our lesser advantaged neighborhoods. As of April 20th, 16th Street has tested 1,013 people, and we've had 244 positive cases, which is about 2/3 of the positive tests in our service area. We have done a lot with our partners to outreach to our patients' families in the community. We've done a texting campaign, sending text messages to all of our enrolled patients, letting them know that testing is available. We have worked hard to communicate the prevention messaging. We have expanded our call center in English and Spanish. So we take between 2,000 and 4,000 calls a day, answering questions that people may have about prevention, about how to handle quarantining, things like that. We are sharing a community toolkit to spread messaging about prevention to local partners on the South Side, through the schools, through the faith-based community, various places that we can get the word out about prevention. We have been hosting some live Facebook sessions, Facebook Live sessions in Spanish with one of our doctors who is answering questions in Spanish live on a weekly basis. We have been engaged with the local Spanish-speaking media to spread messages. And then we've done this yard sign campaign where we've got yard signs all over the South Side, also with messaging about COVID. So we're proud to be a leader on the South Side and in the Hispanic community in Milwaukee. I really look forward to the day when this is all behind us for so many reasons, but one of the things I'm looking forward to is what kinds of studies are going to be coming out of this. And I think we have a lot to learn through this pandemic about factors that lead to transmission, lead to more the higher rates that we're seeing in certain neighborhoods. And I will be fascinated to learn what some of those factors and causes are. So, but like I said, for many reasons, looking forward to the day when we put this all behind us. So thank you.
Thank you, Dr. Schroeder. Next, we'll hear from Ian Bautista, who's the Senior Director of Civic Engagement at the Greater Milwaukee Foundation.
Hey, everybody. I don't have a whole lot to add. I am not a medical expert like Dr. Schuler or Dr. Weston, but I will just share with you that the Greater Milwaukee Foundation and a number of different philanthropies of the public sector, especially folks from the mayor's office and the county, have been involved in a civic response effort and trying to really step up to the challenge of this pandemic and the public health crisis that it represents to meet some of the basic needs of folks. And, you know, in terms of testing, which has been a big topic of conversation so far within this gathering, I will let you know that one of the teams that we have set up is the physical health team that is led by Dr. John Moyer from the Medical College of Wisconsin, who's working with the Milwaukee Healthcare Partnership really to try to address whatever the priority issues are as they arise. They get onto the radar screen so that we can mobilize private philanthropic resources, but also public sector and other civic leadership resources behind that to make sure that people are covered with the basics of what they need to stay healthy and safe and to shelter in place whenever they can. One of the exciting things that I'll share with you all is that we have been part of the effort to bring into the community, again, with the folks who are working in the Medical College of Wisconsin in the physical health space, an effort to bring online about 3.5 million masks that will be assembled and distributed. I have to give a big shout out to the private company who's been behind the supplying of materials for that, which is Rebel Converting. Definitely no stranger to the South Side, no stranger to the 16th Street Community Health Centers. They worked for a number of years with Southside Bike Day and some other community engaged activities to make sure that people are active and healthy in their lifestyles. And so once again, they've stepped up to the plate. The Bucks are involved with that, Pfizer Forum, United Way of Greater Milwaukee and Waukesha County. So an example of what we're doing to try to meet some of the kind of the basic health needs, but also try to mobilize the resources that are available. I've been very impressed with the generosity of Milwaukee and the companies, but also philanthropy, the public sector. There are people that are working literally 24 hours a day to help make sure that we're staying as safe as possible and trying to minimize the negative impact of the pandemic on our fellow Milwaukeeans. So I'm proud to be part of that effort, and definitely happy to get anybody who might be interested in getting involved in that civic response effort. The 6 teams that we have, as I mentioned, are physical health, mental health, food and other material supplies and goods, shelter and housing, the K through 12 and public schools, and also early childhood education. So if you're interested in that response and getting involved with that in any way, shape, or form, don't hesitate to contact me. I'll put my email address down in the chat so that you can contact me if you want to.